Okay, so whenever she told me that, I noticed that her speech was intact. She answered my question, so obviously she could hear me. Her mood is appropriate for the situation. And she, I don't notice anything that would make me think that her nutritional status is not good. So now I'm going to go ahead and I'm going to look at her head and her face. Everything looks symmetrical. I don't, again, see any masses, bruises, lesions. I'm going to feel her scalp first. And I don't feel any masses here, no lesions. Her hair looks good. I didn't notice any missing hair. Let's see, and then I'll look at her face. Her face is symmetrical as well. Can you smile for me? Stick out your tongue. Very good. Okay, so here I'm going to palpate her temporal arteries. Very good. I'm going to feel for her sinuses. Any tenderness?
No.
Okay, no swelling. And I'm going to feel her temporomandibular joint. Very good. Okay. Again, everything was symmetrical, and I didn't notice anything abnormal in that assessment. From here, we're going to look at her eyes. I'll get my otoscope for this. And I will, first, she does make eye contact with me when I'm speaking with her. Her level of consciousness, she is alert and oriented. And that was all the time. Okay, so now I'm going to look at her eyes here. Okay, and now you just look at me. And do it twice on each side. Just inspect both eyes. Okay, her pupils are about 3 millimeters. Her sclera is white. The conjunctiva is pink, and there's no discharge, no lesions or anything observed there. And now I'm going to have her do the cover test. So I'm going to have you cover one eye and release. Okay, and then with the other side, and release. And what I'm looking for here is any muscle weakness. If there was some muscle weakness with the eye, it would have deviated a little bit. Everything was intact with Mary's eyes. So from here, I'm going to look at her mouth. So I'm going to have you go ahead and open your mouth. Okay, and I'm looking at the mucosa, the tongue. I'm looking at the uvula, which is midline, under the tongue, and say ah for me, ah, okay. So her gag reflexes are intact. I would regularly grade her tonsils, but she did have a tonsillectomy, so in that situation I would not. I'm going to look at her ears now. First, I'm going to just inspect the external ear. When I'm looking at the external ear, I'm going to look for any, again, lesions, any drainage, anything that would be inappropriate for a normal ear, anything irregular, and everything looks symmetrical on both sides as well. So external ear looks fine. Go ahead and take a look at the internal ear and the canal. And I can see the canal is not red. I don't notice anything abnormal with that. And the tympanic membrane is gray and pearly color, which it should be. And then again with her hearing, I didn't notice anything earlier when I was talking to her about her hearing, and she was responding to my questions. There was no concern there. Now again, just to test the hearing further, we can do the whisper test. So I'm going to say a 2-syllable word on each side. I'll press down and cover her ear canal, and then she will repeat it back to me.
Apple. Baseball.
Okay, very good. Now I'm going to go ahead and look at your nose. Okay. I don't notice any drainage, no perforations, no deviation. Can you read that for me? Any problems there? Okay. So her nose is symmetrical as well. And again, like I said, there was no deviation with the septum or anything with that. From here, I would look at her neck. So I'm going to look at the fill up for the lymph nodes in her neck. I'm gonna make sure there's no swelling or anything there. Make sure that the trachea is midline, no masses, and everything looks good. From the anterior view, I'll go around behind her now. I'm gonna have you swallow. Okay. And here I am checking to see if I can feel her thyroid. I cannot, which is a normal finding. And then I'll check range of motion. So I'm going to have you just, there you go. And then big circle, very good. And while she's doing this, I'm looking at the range of motion. I also can see that the muscle strength in her neck is very good as well. From here, I would look at, I'm going to go to her chest assessment. So I'm going to assess her chest, anterior and posterior. So first I will look at her, just the configuration of her body, the way her shoulders lay, there's no droop to one side, and then I will look at the symmetric expansion of her lungs. So I'm going to have you just, there you go, just bend on your chair a little bit. So by doing this, I'm going to fill here, and I'm going to squeeze tightly. I'm going to have her take a big deep breath and release. Very good. Okay, and she was symmetrical in that expansion of her lungs. So here, I'm going to go ahead and listen to her lung sounds. Everything should be clear. You shouldn't hear any rhonchi, any crackles or anything. So I'm going to go ahead and take a listen to you. Okay, her lungs sound clear, and when I do this, I am going to do this in the clinical setting. I do it on the back side and on the front side. I'm going to feel here for some tactile firmitus. So go ahead, 99. There you go. 99, 99, 99, 99, 99. Very good. And then I'm going to check her bronchophony. So have you say 99 again. 99, 99, 99, 99, 99, 99. Okay, good. And I should hear a muffled 99, and that's normal, and that's what I heard. So now I'm going to have you go ahead and turn back around for me. And there you go. Okay, and then after I have assessed her front and back side of her lung sounds, I would listen to her heart sounds. I'm going to listen to the 4 valves of the heart, the apical, the pulmonary, tricuspid, and the mitral valve. And then after I do that, and it goes in this order, apical, pulmonary, tricuspid, mitral. And once I do that, I will listen for her apical pulse for a minute. I will want to hear some S1, S2 sounds. Don't want to hear any S3, S4, no murmurs or any other extra sounds in her heart. So, listen there. Okay. Sometimes if the patient has breast tissue, you may have them just go ahead and lift it up yourself so that there you go, you get a better listen. Okay. Her heart rate was about 74, and there was no extra sounds that were heard. Okay, so from here I'm going to go ahead and assess her upper extremities. I'm going to go ahead and have you I'm going to feel for your pulses here, the radial, and then I'll feel for the brachial pulse as well. Okay, and after I do that, I'm going to check her muscle strength in her hands. So I have her squeeze my fingers, and then also another test for this will be to hold your fingers apart and then just try to keep them apart no matter how hard I push here. Very good. Very good. Okay, and so then I'm just going to have you do some range of motion exercises for me. I'm going to have you take your arms and bend them here at your elbows, and then out. Okay, and then go straight up in the air for me, back down, and then behind you. Very good. So I was checking for the range of motion of her hands, her arms, and her shoulders then, her wrists. So from there I would go to the abdomen. Whenever I'm looking at the abdomen, I'll probably have the patient lie down, and in this setting I don't think we're going to be able to do that. So, I would inspect the contour of the abdomen, make sure that everything's symmetrical, make sure there's no masses or hernias observed. Her umbilicus would be midline. It shouldn't be able to feel any pulsations in the abdomen. I would also listen to all four quadrants of the abdomen to make sure that all of her bowel sounds are present. And then I'm going to palpate the liver and the spleen. To do the palpitation of the liver and the spleen, you would do the hook method to go up under the ribs. I'm not going to do that to you, Mary, but that's the procedure that you would use in order to fill. In most cases, you won't be able to fill the liver or the spleen, and that's pretty typical. You don't want to unless they are enlarged. Maybe if there was a trauma of some sort, then you would be able to fill them. I'm not going to do the scratch test because it has been proven to not be very reliable test for the liver. So I'm going to go ahead and do her lower extremities. Again, I'm going to assess her for symmetry. I will be looking at the color of her skin and make sure there's no lesions, any masses, or anything like that. It doesn't look like we have any varicose veins, which is great. Her hair distribution is even on both legs. Okay. And while I'm looking at these, I'm going to go ahead and I'll be assessing her popliteal, her post-tibial, and her dorsalis pedis pulses on both legs. And then from there, we will look at her range of motion. So hips, knees, ankles, and feet. So we'll put this back up. Okay. Okay, so if you want to just stand up for me, there you go. And I'll just have you do, I'm going to have you do, lift your leg, there you go, and then do the other for me. Okay, and if you want to sit back down, I'm going to have you extend your leg and then bend it back behind your knee, very good. And then your feet, stick your feet out, down and up. And then can you move them in a circle for me? Very good. So that covers my bases on the range of motion for her lower extremities. And then I am going to assess her musculoskeletal. So I'm going to just observe her. Okay, hold on, I gotta think. I'm going to observe her joints and her reflexes. We'll do her joints. We'll do her reflexes. The reflexes that we'll test today are we'll do the brachioradialis. So I'm going to hit here, and it should see just a slight movement of the wrist and maybe even the thumb. So we'll do both sides here. Okay, and then we'll do the patellar. Very good. And then the other side. And then the Achilles. And you want to test everything bilaterally on both sides here. Okay, so whenever I had her stand up again, I assessed her gait. I'm going to go ahead and look at your spine. So I'm going to have you stand up again. I'm going to look at the normal curvature of her spine. There should be a concave, convex, and then another concave kind of configuration of the spine. So Mary, I'm going to go ahead and have you just bend down. Very good, and come right back up for me. Very good. There's no scoliosis was noted in that test. So now we're going to check the neural. Forget it. So now we're going to go ahead and look at the Babinski reflex. Okay, so what you want to do is you want to have the patient just keep her eyes closed, and then and you want to make sure that her arms come back up with each time that you push down. Okay, very good. You can put your arms down. Okay, do you want to go ahead and sit down? Okay, so again, I want to go ahead and just check the symmetry of her face, and then we'll check the cranial nerves. So to do this, to do this, I'm going to check the cranial nerves 3, 4, and 6 with the eyes and the extraocular movements of the eyes. So I'm going to have her just follow my finger here. Also, I'm going to have her do the nose touch test. So she'll touch her nose and then touch my finger wherever it goes. Very good. Very good. Couple in place. Okay. And then I'm going to have you just follow my finger back in. Very good. The hypoglossal cranial nerve would be depicted by just sticking your tongue out like we did earlier. Yep. And everything, again, is midline. Oh, okay, yeah, there's one more test that we have to do, and that's, I'm going to have the patient just close their eyes, and then I'm going to touch somewhere, and I want you to try to touch where I touched. Very good. Another test that you could do is to test the patient's sensation. You can use a Q-tip and use the dull side and the sharp side of a Q-tip to test what the patient feels whenever you touch them with either side of that. And I think that will conclude my assessment, and